Welcome to BioPharm 2016. We're here, and I'm going to talk to Jim a little bit about the value of being at a digital medicine conference that's really based around partnering and partnerships. But first, tell us a little bit about yourself.
Thanks, Nicole. It's really fun to be here. This is an exciting time for healthcare, and you're seeing right now the beginnings of the disruption of a $4 trillion industry, and what's happening in this digitization of healthcare is also very important to the biotech industry.
So, what do you look for in partnerships?
Well, I'm a cardiothoracic surgeon by training and an entrepreneur by passion, and it really is. This is a new frontier. It's a new frontier for all of us in healthcare and how we're going to deliver healthcare in this new world, especially in moving from fee-for-service to value-based care. And technology is really a necessary requirement to make that transition. So when you look at a partner, I think there's a lot of putting your toe in the water and trying to figure out what this really means and how do I play. And that's okay, but you can see a lot of spinning around in those scenarios. So partners that understand this is what they need to do. They may not know exactly how to do it, and that's why they're kind of seeking out for help and assistance, and that's where we really start to engage. And Qualcomm, as the parent company of our Qualcomm Life medical division, has had a long history in enabling a global ecosystem of smartphones and wireless communication. And so we apply that same approach to the healthcare industry and working with biotech and pharma in particular.
Well, I like what you said about sort of the way they complement each other, the partnerships, and coming from DC and constantly thinking about how we're going to manage all of these different things, everything from, value, how hard it is to reimburse for value.
Exactly.
Right? And so it's so nice to see and yet frightening for us because new partnerships are emerging that make complete sense. But then you think, what does that mean?
Yeah.
Right, what 1 + 1 = what now? You don't necessarily know.
There's a lot of moving parts,
yeah.
and it's kind of, forgive the expression, but cats and dogs sleeping together for the first time, where organizations historically that had some antagonism are finding themselves in need of cooperation and collaboration. And in some cases, it's very much CoOp-etition, where they will compete, but in this circumstance, they're going to collaborate. And you mentioned it, the dynamics kind of traverse the pharma, the provider, the payer, and the retail pharmacy, and figuring out who plays what role, and also very importantly, who's going to pay for this. Yeah. And so the great news is we're as Qualcomm Life very effective at playing a neutral role. We are very much Switzerland in our approach, and so as we've done with the cell phone industry and the carriers, we're able to enable an enormous ecosystem that otherwise may not work so well together, and we become kind of a common denominator that actually allows these organizations to work together. So as an example, we just made a big announcement about Philips coming onto our platform, as well as Boehringer, but we have also announced Novartis working with us and building out very similar systems. and yet we have Walgreens on the platform where all of their devices are uploading through our platform, and on top of it, United Healthcare. So you have a scenario where now on a single common denominator, all of these different parties can literally collaborate in an effortless way.
CoOp-etition, I like that. That was great. So, okay, I actually want to dig a little bit into this. Goodies, and talk about a wide range of goodies. We have Band-Aids. I don't even know what all is here. Inhaler, pregnancy test, and some chips.
Yeah.
Okay, so what are you doing?
So
broad question. What are you doing?
And this speaks to what we are about to see in healthcare, right? So for the last 5 years, we've seen a literal explosion before our eyes in these. All of us have one of these in our pockets, and there's now about 14 billion of these on the planet Earth.
Some of us have multiple.
My condolences.
I know.
But what you're about to see is literally over the coming 5 years, we're going to go from 14 billion devices to 50 billion devices that are connected. And these are going to be things beyond our smartphones. They're going to be your automobile, they're going to be your drone, they're going to be all of healthcare. And people tend to focus on the blood pressure meters and the glucose meters, but what we are very quietly doing in broad terms is enabling everything imaginable, from diagnostics, like home pregnancy tests, therapeutics, which means you're going to be able to capture digital data coming directly from an inhaler or an injector or even a tube of cream, and be able to know when was that opened and how much of that cream was actually dispensed. And then the biometrics, which the biometrics themselves are going to change dramatically. We're going to move from kind of clunky, hard to use medical instruments that were never designed for consumers or home use to literally a sticker that does stuff that we never imagined. In fact, Qualcomm has sponsored over the past 5 years the X Prize. If you remember the X Prize, we sponsored an X Prize for a tricorder. If you're a Star Trek fan, Dr. McCoy used to carry around a tricorder, and this is, ironically, the 50th anniversary of the original Star Trek series. And so we launched this competition in 2012, and it's a $10 million prize for the first company that is able to develop a handheld device that will wirelessly diagnose 15 or more medical conditions as well or better than a panel of physicians. And we literally have 10 finalists, and the winner will be announced at the beginning of next year.
I can't wait.
So you're going to see a complete array of connected stuff across all of healthcare. And it's interesting, you know, people kind of giggle when I talk about the first connected home pregnancy test. And this is live and on the shelf in your retail stores right now. You can go get one at Walgreens, and it's literally got a Bluetooth chip built into it. Now, people giggle and say, well, is that to be able to upload your pregnancy results to Facebook and make a lot of guys nervous? Sorry. But in reality, it turns out that this test, like many of the tests you're going to start seeing in the home setting, is incredibly accurate. It's 99.9997% sensitive to what's called beta HCG, which is the pregnancy hormone. So if this says you're pregnant, and it's sensitive within 1 week of conception or something close to that. So the problem is when you find out you're pregnant, you go to your pharmacy to get your neonatal vitamin or prenatal vitamins or other services. They have no record of you being pregnant yet.
Right.
And so what do they tell you? They say, oh, you've got to go to your doctor
Yep.
and get the official pregnancy test.
We've now taken that step out completely.
Well, think of the delay in
Right.
being able to deliver care,
Right.
and in some cases educate this newly pregnant woman that she should stop smoking, stop drinking. Maybe she's got a family history of high blood pressure and we should be measuring her blood pressure. Maybe she's got a family history of diabetes. So you're starting to see this connectedness can now reduce cost and actually improve care. And if we can prevent one fetal alcohol baby, the cost to society for that premature delivery and the intensive care unit stay is hundreds of thousands of dollars. And that potentially could be prevented just by this earlier information. And you're going to see everything, all this stuff, care is going to get moved out of the hospital and out of the clinic. Instead of you going
Right.
to care, care is going to come to you.
Exactly. So last question, building off of that. So we keep talking about the last 5 years. I've heard this over and over, right? The last couple of days about so much has happened. And over the next 5 years, so much more is going to happen. The rapid pace at which technologies are developing is incredible. So the value of BioPharm, what brings you here today about getting that care to the patient faster, easier, cheaper? Why are you here today?
Sure. Well, we know that pharmaceutical and therapeutics are a big component of healthcare costs. It's a lot of concern on the part of policymakers and payers. And what we want to do is help biotech and pharma be able to leverage technology to deliver the information that shows patients are getting the drug that they're supposed to get, and they're getting the benefit that we're expecting and paying for that drug. And the only way to do that is to connect to the drug delivery systems like a connected inhaler, and then be able to have essentially sensors that are going to document that this patient is actually getting the therapeutic benefit and the outcome that we all want from that drug.
And you can do that here.
That's right.
All right. Well, thank you very much.
Sure, my pleasure.
Yeah, have a great day.